Hello, everyone, and welcome to Iowa State University. My name is Jessie Beyer, and I'm going to be taking you through this presentation all about recognizing trauma, how to support someone who may be struggling with healing from trauma, how to release trauma using natural and integrative therapies. We're going to cover it all today. We're going to be spending about 60 minutes together now before we move into the live question and answer session. So make sure you clear away any distractions. Turn your phone on silent, close down any extra browser tabs, whatever you need to do to really focus on this presentation so that you can get the most out of it. Now, just to give you a bit of an agenda for what we're going to do today, I'm going to introduce myself here in a little bit more detail so you get to know exactly who I am. Then we're going to talk about how to recognize trauma, what some of those signs and symptoms are. After that, we're going to discuss a couple specific strategies that you can use to support someone who's healing from trauma. Perhaps a student shares this with you, a coworker, a friend or family member, something like that. Then discussing the 9 natural and integrative therapies that can be really powerful for healing from trauma. And then, like I said, we'll move into that Q&A session. So we've got a lot on our plate today, and let's dive right in. Like I said, I wanted to introduce myself. So my name is Jessie Beyer, and I am the author of How to Heal, a practical guide to 9 natural therapies you can use to release your trauma. You guys are going to get a really good insight into my book throughout this presentation because a lot of what I'm talking about today is pulled directly from my book. I'm a speaker as well, and I've spoken at a lot of different college campuses and conferences about mental health and trauma and how to support someone who may be healing. I am also a trauma and mental illness survivor myself. So not only does the information I share come from research and expert interviews and things like that, but it also comes from my own personal experience. Finally, I am a University of Minnesota alumnus. Go Golden Gophers, and I still think that's probably the worst mascot out there. So you Cyclones have it better than I do. Now, why are we talking about trauma in the first place, right? Why is this such an important topic? Well, an estimated 70% of Americans will experience a trauma during their lifetimes. That's a really high number, right? Additionally, with everything that's going on with COVID and the quarantine and some individuals losing family members, that's been incredibly traumatic for a lot of people. In addition, everything with racial injustices and police brutality, especially against people of color that have happened and come to light over the past couple months, again, that can be traumatic. And finally, that huge storm that swept through Iowa recently. Again, that can be very traumatic. So all in all, there's a lot going on in our world right now that can be very, very traumatic, that can bring up past trauma for people or perhaps cause them new trauma. And so this is a really important topic to talk about. Unfortunately, that 70% estimate, where 70% of Americans will experience a trauma, that number is probably actually higher. Not all traumatic events are reported or discussed. Some people keep them very close to their chest. In addition, many trauma survivors don't seek mental health care, and therefore they're not able to receive a diagnosis and become part of this 70% number. Finally, some trauma survivors unfortunately die by suicide before they're ever able to get help or talk about their trauma. So again, they wouldn't be counted in the 70% number. Now, talking about what trauma could look like, obviously if someone comes up to you directly, like I said, a student or a faculty member and says, hey, this happened to me, I'm struggling with this. Obviously, you know pretty well that they're suffering from trauma, but if they don't tell you about that, what are some signs that you can look out for? First, let's talk about some of the psychological symptoms. Distressing memories or nightmares are probably the most common one, and that's what most people think of when they think of trauma, right? Oh, they have nightmares. It can also be flashbacks, again, another very common symptom. It can be things like efforts to avoid things that remind them of the trauma. So avoiding people, avoiding places, avoiding discussing certain topics. They can have dissociative amnesia and maybe not remember parts of their traumatic event. They also can have really strong negative beliefs about them and the world. Those can then turn into some negative emotions like fear, horror, anger, shame, and or survivor's guilt. They can pull away from their loved ones, friends, family members, coworkers, people like that. They might be sleeping really poorly, perhaps because of those nightmares or just because of the trauma in general. They can be very irritable and have outbursts, either verbal or physically angry outbursts. They are also commonly very hypervigilant, meaning that they are way too aware of everything that's going on around them. They can also have concentration problems or an extreme startle response. Finally, self-destructive behavior is common, and this doesn't necessarily mean things like self-harm, but it could be overworking, it could be working out too hard, it could be eating way too much food, anything that kind of falls in those unhealthy coping mechanism behaviors. Now, there's a really powerful study in the field of trauma called the ACEs study, and an ACE is an adverse childhood experience. Basically, this study examined the relationship between childhood trauma and adult health outcomes and found that the more childhood trauma someone had, the more likely they are to develop adult health problems. Now, these health problems range so widely, but here are just a couple of what those could be. Anxiety, depression, and suicide attempts, asthma and COPD, autoimmune diseases, broken bones, cancer, chronic pain, including headaches and migraines, diabetes, heart, liver, and lung disease, high blood pressure, multiple sexual partners, unintended pregnancies, STDs, kind of anything in that world of poor sexual health habits, obesity, stroke, substance use and abuse, including hard drugs, cocaine, things like that, as well as alcohol and nicotine. So this list is so broad and so diverse, and it's crazy to think that childhood trauma, which is a relatively specific thing, can result in such a wide range of adult health outcomes. Now, these symptoms, either the psychological ones or the ones that can result from childhood or past trauma, that doesn't necessarily mean that that person has this huge trauma history, but it is something to keep an eye out for if you start to see these things pop up over and over again. If you believe that someone is healing from trauma, or like I said, if someone comes up to you and says, hey, this happened, I'm struggling with this, I want to share with you 4 specific ways that you can really help them in their journey. We're going to spend about 5 or 10 minutes discussing this and then dive into some of those natural therapies that I'm sure a lot of you came here for. So hang tight. The first one is validating their emotions because they already feel like they're out of control and crazy. The trauma survivor that they're probably unearthing a lot of emotions and memories that are really painful as they're moving through their healing journey. And that can lead them to think that they're being out of control with their emotions, that they're being dramatic, that they're crazy, that they're overreacting. All of these labels are not really healthy. If you're able to come in and say, hey, what you're feeling is completely okay, that takes a lot of pressure off of their shoulders. That energy that they were using to judge themselves and criticize themselves can then be redirected into healing from their trauma. The second strategy is treating them as normally as possible. They're still the exact same person, right? Someone who's struggling with their mental health or someone who's healing from trauma, they're not broken, they're not weak, and they're not about to break either. They don't need to be protected or handled with any sort of kid gloves or anything like that. Whatever you normally do with that person, continue to do. So if you have office hours, if it's a student perhaps, and you have office hours with them every Thursday at noon, still have those office hours and still run them the same way. If you go out for coffee with a coworker every single Sunday, continue to take them out for coffee and invite them to do those things with you. This will enable them to retain a sense of normalcy in a life and a time period in their life that already feels so abnormal. The third strategy is holding the space for them. And this, in my opinion, is the absolute best thing that you can do for them. There's a woman out there named Heather Plett, and she's a coach that works with people and holds the space for them as they move through personal development journeys. And this is how she defines holding the space. She says it means being willing to walk alongside another person in whatever journey they're on without judging them, making them feel inadequate, trying to fix them, or trying to impact the outcome in any way. When we hold space for other people, we open our hearts, offer unconditional support, and let go of judgment and control. You have to choose to sit in the dumpster with them, even if you want to climb right out. Now, what do I mean by that dumpster? Well, a really great story that illustrates what holding the space means was told to me by a woman named Sally. Sally's an equine assisted therapist from Minnesota, and she was playing hide and go seek with a young client on her farm one day. They decided to go hide in the dumpster. And as you can imagine, it's a dumpster, right? So it's dark, it's smelly, there's something dripping over their shoulder. All in all, it's not a fun place to be. This young girl looks at Sally and says, hey, Sal, this is kind of like life, isn't it? Now that moment hit Sally so hard because for that young girl, that is exactly what her life felt like. It was dark. She was isolated. She was alone. It was not a fun place to be. Now, Sally, she could just get out of that dumpster, either literal or proverbial, whenever she wanted to because she wasn't having those mental health struggles. But for this young girl, she didn't have a choice. For Sally to choose to sit with that girl in her darkness, let her know that she's not alone, that she has someone on her side, and not judge or criticize her for whatever comes up, that is what it means to hold the space for someone. Now, there are technically 8 steps or 8 core pillars to holding this space, so I do want to walk through these with you really quickly. The first is intuition. Trust your intuition in terms of how you want to relate to this person, and also give them permission to trust theirs. That will allow them to start to build up trust in themselves again. Also, don't overwhelm them with information. It can be really easy to get a bunch of books and pamphlets and printouts and all of this stuff about trauma and healing from trauma and shove it in their face and be like, look at all these things you can do. But that can be really overwhelming for someone who's already battling this huge war in their mind. The third piece is autonomy. Allow them to keep their autonomy and make decisions for themselves. You don't want to come in and parent them or start doing things for them, making choices for them, because during their trauma, they didn't have a choice. That was something that happened to them that was out of their control. So allowing them to have control, to have the option of choice, is very, very powerful in the healing journey. The fourth pillar is failure. And in my opinion, this is probably the most important one for you as the supporter to understand. Their failure is not your failure. So keep your ego out of it. If they don't progress towards healing as quickly as you thought they would, or if they relapse, that doesn't mean that you held the space improperly or that you weren't a good friend, family member, coworker, professor, whatever that is. Their journey is their journey, and it's not a reflection on your ability to be a good support system for them. The fifth pillar is creating a safe space for them. You want to remove any sort of judgment, criticism, shame, anything like that from the equations that they feel they can come to you with anything they may need. The next pillar is help. And this is kind of a conflicting one. You want to help them as much as you can, but you want to do it in a way that doesn't make them feel incompetent. Remember, you want them to have their autonomy, have that freedom of choice. So you don't want to come in and do the dishes and make them food and clean their house and like do all these things for them, because then they're like, oh my gosh, I can't do anything. I'm a failure. And again, that's not a good mindset for healing. The next one is catching them, which is making sure that they know that you are there for them, right? That you are able and willing to catch any of their broken pieces if or when they fall apart. Now, this isn't something that you verbally express to them like, hi, Susie, I'm here to catch you. But by showing up confidently, compassionately, empathetically, you will let them know through your mannerisms that you are on their side. The final step, I'm going back to that same thing, is about choices. You want to allow them to make their own choices, even if you think they're making a mistake, even if you think that they're different than the choices you would have made if you were in their position. You want them to have that power and that freedom of choice. Now, the only caveat for this is if they're doing something that endangers themselves or others. So if that's the case, definitely, hold an intervention, get law enforcement involved, whatever that needs to be in that situation. But for most of the situations, it's going to be allowing them to make that choice for themselves. Now, the fourth strategy is about connecting them to resources, because no matter how incredible of a support system you are, you can't do it all. You play a very, very important role in this person's healing as a coworker, a professor, a friend, a family member, whatever that is. But you're not a mental health professional. I'm assuming you aren't, at least for the purpose of this argument. If they'd like some additional help along the journey, you can absolutely connect them to a licensed mental health professional near you. You can help them research what therapists are out there. You can look at different types of therapy, some of which I'll cover in the next, half of the presentation here. And you can also even visit some facilities with them just to get a feel for it and see if that would be a good fit for them as they move through their healing journey. Now, in terms of types of therapy and types of therapists you can connect them to, talk therapy and integrative therapies are kind of the two main types available to trauma survivors. Today, we're going to focus on integrative therapies because there's a chance that talk therapy might not be the best fit for them. First of all, many people won't go. Because of the stigma surrounding therapy in modern culture, a lot of people are not even willing to consider talk therapy as an option. Secondly, talk therapy is very cognitive, but trauma isn't. Talk therapy works with the cognitive processes in the prefrontal cortex, but trauma, that lives in your limbic system and your body. Finally, talk therapy doesn't address the somatic component of trauma. Like I said, there's a bodily piece, a somatic piece, as well as everything that's happening psychologically. And simply talking about it isn't often enough to release that physical part of trauma. Now, talk therapy is a fantastic option. It is very well supported by research and expert testimony. But because of these reasons, adding in an integrative therapy or even swapping it out for an integrative therapy might be a good approach for some trauma survivors. Obviously, help them find what they're comfortable with and what works for them, but just so you're kind of aware of why we're focusing on these integrative therapies instead of talking about traditional talk therapy methods as well. All in all, like I said, they can be a powerful addition or alternative to talk therapy. The first one we're going to discuss is EMDR, or eye movement desensitization and reprocessing. If you know anything about this therapy, you'll know why I have a metronome sitting there. But if you're not sure, let's dig into this and talk about exactly what it is. EMDR reframes how this trauma survivor views their trauma and themselves after their traumatic event. So a trauma memory, right? That is an incorrectly stored memory. Excessive cortisol levels, which is your stress hormone, that can actually be toxic to the hippocampus, which is the part of your brain that encodes memories. What EMDR does is it comes in and reprograms those trauma memories so they're not so traumatic. It doesn't have the weight of all of those emotions sitting on top of it. Now, how does EMDR work? It's not just the bilateral stimulation. That's why I had the metronome there. If you know anything about EMDR, you're probably thinking about the part where the therapist sits in front of the trauma survivor and waves their hand back and forth in front of their face. But there's actually a lot more to it than that. At the beginning of the session, the trauma survivor is going to be asked to rate their distress on a scale from 0 to 10 and their level of strength and a positive belief about themselves from 0 to 7. The goal of EMDR over the course of the therapy session or the course of therapy in general is to move that distress level down to a 0 and move that strength and a positive belief up to a 7. Pretty straightforward. This is done largely through bilateral stimulation, which, like I said, moving the hand back and forth in front of the face so it crosses your center plane and therefore stimulates both sides of your brain. The exact reason why bilateral stimulation works with memory reprogramming is still slightly unknown, but it's thought to work so well because the eye movement that occurs as you're following a finger mimics REM sleep. And during REM sleep is when all of our body's natural healing mechanisms start to work. It's why we wake up and our bruises are gone, our cuts are healed, our broken bones heal over a period of time. It's thought to access that same self-healing mechanism. Now, a few success stories to share with you of trauma survivors who have undergone EMDR. One woman had 4 trauma memories that needed to be reprocessed, and she was anxious. She never let her children go anywhere alone, and she carried pepper spray with her all the time because she was just terrified of everything around the next corner. After EMDR, she loaned her pepper spray to a friend. She took a solo trip to Europe, and she even let her son go on a school trip across the country without chaperoning him. Another woman dropped her daughter off at college and just was a mess. She couldn't work, she couldn't get out of bed, she couldn't stop crying because her dropping her daughter off at college brought up all of her memories of her past rapes and childhood trauma. Now, after EMDR, she formed a decent relationship with her father. She went back to work and she stopped struggling with anxiety and depression. If you or someone you know is looking to try out EMDR and see how that works, you can visit the EMDR International Association's website, and in the upper right-hand corner, there's a bright orange button that says Find an EMDR Therapist. Just click on that, and that will bring up a searchable database of all the different therapists near you. Now, EMDR therapists are very common. I think the last time I searched, there were 49 of them within a 10-mile radius of my house. So it should be very easy for you to find a therapist to work with for you or someone you know. The next therapy we're going to discuss is craniosacral therapy, or CST. CST, again, harnesses the body's natural healing mechanisms to release the physical part of trauma that's stored in their body. Stuck energy, that physical part of trauma, is identified through the laying on of the hands of the practitioner to feel the craniosacral rhythm. This is a rolling sensation in response to the levels of cerebrospinal fluid in your spinal cord and in your brain. In areas where the trauma is stored, this rhythm will be weaker, or it'll feel like there's a tug where it's stuck up somewhere. Now, this isn't a massage. You're not getting a massage to release this part of your trauma. When the practitioner finds an area with stuck trauma, they're going to add about 5 grams of pressure to match the pressure that the body's exerting in that area. CST accesses that body's self-healing mechanism, like I mentioned, and supports it and amplifies it, either energetically through the session or with external resources and other modalities of healing. The environment that's created in CST focuses on everything that they've learned from their trauma. So all of the coping mechanisms, all of the new positive beliefs that they've imprinted about themselves. It uses all of those to reframe how they view their trauma and themselves after the trauma. It is extremely client-led, and it often incorporates other professionals like a chiropractor, a licensed mental health therapist, an acupuncturist, holistic medicine doctor, things like that. Now, some research studies that are out there, I wanted to share with you because when I first heard about CST, I was like, yeah, right, okay, that's cool. But when I saw some of these studies and how powerful they were, I started to change my tune a little bit. First of all, 10 sessions of CST were effective in decreasing pain and improving sleep length in veterans who suffered from TBIs. In addition, 2-hour-long sessions of CST were effective in reducing anxiety related to PTSD. And an intensive CST program for veterans with PTSD showed great improvement in PTSD symptoms, anxiety, depression, fatigue, as well as improvements in social function, relationships with their therapists, and sleep quality. A few success stories to share as well. One woman was serving in the Navy when she was raped and thrown off a 75-foot cliff. She found immense social and physical healing from CST, and she described it as digging through all of the muck of your trauma, clearing it out, and leaving a clean meadow in its wake. Another man, a 56-year-old veteran, he had PTSD from a helicopter crash, and he was suffering with anxiety, depression, and troubles connecting with others, in addition to everything he was struggling with because of PTSD. By day 3 of an intensive program, he said that he rid himself of a 100-pound backpack of survivor's guilt. And by the end of the intensive program, he was significantly more excited for his future, he was more optimistic, and he was able to connect with important people in his life more easily. Now, the interesting thing about CST is there aren't CST therapists. The official licensure is some sort of certificate, licensure, degree program, whatever, that allows them to place their hands on you that specializes in CST. So for example, you could be a nurse who specializes in CST, a massage therapist who specializes in CST, something like that. Because of that, there's no one certifying body, but a very large database of practitioners can be found at iahp.com. The third method of healing I want to discuss is mindfulness and meditation. Now, you've probably heard of mindfulness and meditation before. Perhaps you even use it in your own life. But I really want to dig into why and how this can be effective for trauma healing. First of all, meditation itself might actually be harmful for some trauma survivors. So a mindfulness approach can be a good alternative. Now, why is this? Well, for some people, sitting still and closing their eyes and looking inward can be anywhere from terrifying to impossible because of their hypervigilance. Breath control, which is common in lots of types of meditation, can actually bring back traumatic memories as well based on what your trauma is. For example, think of a Navy SEAL. When you're learning to shoot a gun, you're taught to control your breath and breathe in a certain manner when you pull the trigger. And so for this individual, doing meditation with any sort of breath control can bring back all of his traumatic memories from when he was in the service. The goal of mindfulness or meditation, whichever approach you take, is not to sit there and go for an hour or 2 hours or anything like that. It's actually to gain some control over the mind and the body. Essentially, it's training your brain. The goal of mindfulness or meditation, if you decide to go that route, is to bring the brain back to the same place over and over again. Now, the thing with mindfulness that makes it really good for trauma survivors who struggle with hypervigilance is that you can be mindfully doing anything. You can be mindfully washing the dishes, mindfully folding laundry, mindfully walking the dog. You're actively doing something, so you're not sitting there and meditating, but you're still being mindful. What they're doing in those situations is training their brain to come back to center during a flashback or traumatic event. Now, mindfulness is hard. It's really hard to quiet your brain and bring it back to center for extended periods of time when you're starting. So just start with 5 minutes a day, or instruct your friend or family member to start with 5 minutes a day and build from there. If you want to go a meditative route or suggest that someone else goes a meditative route, there are a couple of forms of meditation that have been shown to be really powerful for trauma survivors. The first of which is loving kindness meditation. Now, this meditation increases self-compassion by sending positive thoughts to yourself and to other people. One study in 2013 found that 9 weeks of this type of meditation resulted in increased feelings of self-compassion and decreased negative symptoms related to trauma. Transcendental meditation is another form of meditation. And what this meditation is repeating a mantra that quiets your brain, centers yourself, brings your attention inwards, and allows you to connect with consciousness. Now, this meditation specifically for trauma survivors has been studied extensively, and it can help veterans with PTSD, which was found in one study, become calmer, more patient, more positive option for healing. This type of meditation, as you guessed, is all about regulating your breathing and breathing in a certain pattern. These patterns normally fall into one of 4 types, and for context, the average adult breath rate is 12 to 20 breaths per minute. The first type of breath is victorious breath, which is 2 to 4 breaths per minute, so very, very slow. The second is bellows breath, which is breathing at 30 breaths per minute, so again, very, very fast. The third is an Om chant, so repeating the Om sound and stretching it out for a long period of time. And the fourth is proper vision by purifying action, which are rhythmic and cycled breaths at slow, medium, and fast paces. Again, this type of meditation has been studied extensively, and there are a lot of benefits for trauma survivors, including reduced post-traumatic symptoms, lasting reduced respiration rate, improved mood, decreased anxiety, and the list can go on. One thing that's really cool about this meditation is one study found that a very concentrated dose of breathing-based meditation followed by occasional reinforcement produced long-lasting results. So if you do a concentrated dose of this and then kind of don't do it for a little while, you're still going to experience some of those benefits. If you or someone you know wants to incorporate meditation into their therapy process, really, really simple. Just ask their existing therapy provider or instruct them to ask their existing therapy provider to incorporate it into the program. There isn't a certifying body for meditation except for transcendental meditation, but about 88% of therapists who use meditation with their clients also use that in their own life. For transcendental meditation specifically, that type of meditation is practiced under a certified trainer, and you can find trainers in that meditation type at tm.org. Dance movement therapy is the next therapy that we're going to discuss. And don't worry, this is not expecting you to tango across the room in order to heal from trauma. Dance movement therapy is actually a creative arts therapy that works with the mind-body connection. So it looks at that somatic piece of trauma very heavily as well. DMT can reduce the time it takes to return from a dissociation because you're learning to be more comfortable in your body, learn what your body needs, what the signs are of things that are about to happen in your body and things like that. And it also can help recognize the body as an ally instead of an enemy in the healing process. One thing that's really cool about dance movement therapy and what makes it so effective is that it's non-goal-oriented movement. In traditional dance, it's goal-oriented, right? There's a choreography, a set of moves that you are expected to complete in a certain way. But dance movement therapy, there are none of those goals. You are moving how your body wants to move. And that non-goal-oriented nature actually results in some pretty cool benefits, like decreased stress, improved well-being, and improved body self-efficacy as well. Now, DMT works without words. And that's very important because every body speaks, even if the person who has that body can't form the words. Trauma is a very full body experience, as I've talked about multiple times. It's not just psychological. So accurately describing how they're feeling with words can be very, very difficult. The deep effects of trauma as well can make this person not want to speak or not be able to speak, which render almost all forms of talk therapy impossible, right? Finally, there are vast cultural differences in how people talk about trauma. For example, some cultures, they don't talk about emotions very much. And so they would describe their trauma as a fiery sensation in their body. They talk about the physical sensation as opposed to the emotions surrounding it. Other cultures are way happier talking about the emotions. I'm sad, I'm angry, I'm hurt, whatever that is. But when you ask them to talk about how it feels in their body, they're like, I don't know. That's a lot more difficult for them. So dance movement therapy is able to work around all of these barriers because it's solely movement-based, and there's no definition or discernment between whether it's an emotion or whether it's a sensation in the body. They're treated as exactly the same, and the therapy progresses with movement no matter what it is. There are 3 main goals of dance movement therapy, the first of which is regaining control. As I mentioned when talking about the 8 steps of holding the space, a trauma survivor had their control stripped away from them during their traumatic event. And so a goal of therapy is to get them back into a place where they feel they have control over their body, over their lives, and over what happens to them. A second goal is completing the cycle. When a traumatic event happens, you have a fight, flight, or freeze response. And that freeze response can actually keep that cycle of emotions and hormones that gets ramped up during a traumatic event stuck in your body. That is that stuck part of trauma, that somatic part of trauma. And so a goal of dance movement therapy is to allow that cycle to complete itself and therefore release that somatic part of trauma. The third goal is coming back to self. So something that'll commonly happen in dance movement therapy is the person will be asked to go back to their trauma in their mind and then come back to their present physical body in this current time. That sort of oscillation or pendulation gives them practice of doing the same thing and coming back to their present adult body when a trigger or a flashback occurs. Now, dance movement therapy starts by examining their relationship with their body. So what do they know about their body? What do they know about their trauma? What methods of healing have they tried? How have they worked? How is their trauma impacting their life? All of these different things give both them and the therapist a very good base level idea of where they're at in their healing journey. The next piece is listening to their body. How would their body want to move? Does it want to tense up? Does it want to relax? Does it want to stand strong? Does it want to curl up into a ball? How does their body want to move? And then follow that movement. Now, the therapist helps guide this session through two really cool phenomenons. The first is somatic countertransference, and the second is kinesthetic empathy. These are very similar things that both basically mean that the therapist is able to feel what they're seeing in someone else's body in their own body. So they kind of have an idea of what this person might be feeling, and they use that to help guide the session. A few success stories from this to share with you as well. One is about a family who had been dramatically affected by domestic abuse. The children had violent and emotional outbursts, and that triggered the mom's memories and traumatic memories of her husband's abuse, causing her to become fearful of her children, and it was just this downward spiral that they couldn't get out of. After a few months of dance movement therapy, their verbal communication improved, their anxiety decreased, the mother was seen as a leader in the family again, and the concept of fun and playfulness was reintroduced into their lives. Another story is about a woman who was kidnapped. She was raped, beaten, and starved for a month after witnessing her brother being killed in front of her and after being physically ripped away from her children. I don't know about you guys, but I don't think I can imagine something much more traumatic than that. So she had been through a lot. Over the course of months of dance movement therapy, she went from constantly worrying about her children, an inability to make eye contact, and pretty frequent dissociation from her body, to feeling safe in her body, feeling confident, being able to make eye contact, wanting to live again, and even inviting her therapist to share in a cultural dance from her past. All dance movement therapists will be certified under the American Dance Therapy Association, and you can visit their website to, again, search a database of therapists to either go to yourself or refer someone you know to. The next therapy we're going to discuss is trauma-sensitive yoga. Now, the goal of this, similar to dance movement therapy, is to connect their mind and body again. Being conscious of the body and present in the body for a trauma survivor, especially one who has survived an interpersonal assault, can be incredibly challenging. What trauma-sensitive yoga does is it attempts to make their body a safe space again by allowing them the space to learn to trust their body, feel what's going on in their body, and make decisions for their body based on that information. This is done largely through the concept of interoception. And what that means is the ability to feel what you need in your body. So for example, if you are leaning down to stretch your hamstrings, you can feel the tension in your hamstrings that says, okay, that's enough, don't go any further, that's as far as I can go. It's that type of sensation and that type of knowledge that you're getting from your body that is heavily focused on in trauma-sensitive yoga. Now, how does it work? Because it's not traditional yoga. You're not going to be doing down dogs and all these different poses. I don't do yoga, so that's about the only pose that I know. But what it does is it incorporates both the principle of choice and a form of gentle yoga. It's a nice, conglomeration of those two. There's always an opt-out as well, meaning that they can leave the room, they can do a form differently, they can never come back to class again if they don't want to. Again, they have that choice to do what's best for them and their body in that current situation. There are also always multiple modifications of every single pose so that anyone, no matter their ability, their comfort, anything like that, can do any of the poses. These are often aided with props like blocks and bands and pillows and things like that, just to make sure that anyone, no matter what situation they're in, can participate in trauma-sensitive yoga. Now, the emphasis, like I said, is on noticing what's happening in your body, what sensations, what feedback you're getting, and then making decisions based on that. It's also a great opportunity to approach mindfulness and work through that fight, flight, or freeze response. If they notice themselves freezing, they know cognitively that they're in a safe place, and so they can work themselves down back to present in a space where they know they're not going to be harmed. Now, trauma-sensitive yoga, that term specifically pertains to classes and instructors certified through the Trauma Center in Boston. They were the ones that actually came up with trauma-sensitive yoga, but there are other adaptations out there. If you're looking at a class that says trauma sensitive yoga, that will be by someone certified through the trauma center. If it's something like yoga for trauma healing, that could be someone who has different mental health experience, different yoga experience, but isn't certified through the trauma center. Just keep that in mind as you're looking at different therapists and instructors that may offer this for you or someone else that you know. And if you want to be on the safe side, I would recommend looking at traumasensitiveyoga.com, which is the trauma center's yoga website, and looking at their list of instructors there. There are instructors all around the globe and all across the country, so you will have no problem finding one close to you. The next type of therapy we're going to discuss is equine assisted therapy, which is the use of horses and interactions with horses to reposition their perspective of their trauma. Now, horses are incredibly intuitive and they can model being grounded and aware at the same time. For many trauma survivors, they suffer with hypervigilance. And so they're like, wow, 110% all the time. Whereas a horse can model being aware of everything that's around them. So not quite hypervigilance, but being aware and still being calm and grounded at the same time. In addition, there is no judgment, there is no expectations, there is no agenda with working with horses. EAT also incorporates nature and movement, which are two powerful forces for healing. The first type of EAT we're going to discuss is EAGALA, which is using metaphors for healing. The Equine Assisted Growth and Learning Association is the full name for EAGALA, but it's usually known by its acronym, which again is pronounced EAGALA. Now, sessions here are entirely on the ground. There is absolutely no riding of the horses, which means that anyone, no matter their ability, skill level, comfort with horses, can come in and participate in this therapy. There are 4 stages to it as well. The first of which is observation. When this person walks onto the facility, what do they see? What do they identify with in the field? How are the horses in the field and everything laid out? The second is relationships. How do they relate to the scene in front of them? Is there a horse that they identify as themselves? Maybe a horse they identify as their trauma? How do they play a role in what's in front of them? The third is movement. Perhaps this trauma survivor feels like life is going way too quickly and they just need to slow it down. So they would physically slow down the scene in front of them, have the horses stop moving and things like that to mimic that peace and stillness that they need in their life. Perhaps that trauma survivor feels really stuck. They're not going anywhere. They're not progressing. That would be an opportunity for them to then move the scene in front of them to again simulate that movement in their real life. The final piece of this is creation. When the trauma survivor is ready to step into their healing journey, how would they want that story acted out? What would they want their new life to look like? This would include moving the horses, interacting with the horses, perhaps using props to again act out that story of healing and a new life that they're looking forward to. EAGALA EAT is based on a 4-legged stool, the first of which is the survivor, the trauma survivor. They are the center of the therapy process and they're always in control. The second leg is the horse. The horses and interactions with them serve as metaphors, and healing can occur by what you see, how you move with them, what stories you create with them, and things like that. The third piece is the therapist. So a licensed mental health professional is always part of the team to care emotionally for the trauma survivor. The fourth is the handler, the animal handler, an equestrian specialist. And they will always be present whenever a horse is involved in the session to ensure the physical safety of the survivor, the therapist, and the horse. They are also able to comment accurately on the horse's behavior and give a little bit of insight to what that horse is doing, what it may mean, and things like that. Now, the second method of EAT is EPONA, which uses movement for healing more than metaphors for healing. This type of EAT includes groundwork, riding, husbandry, and activities like stretching and journaling with the horse. Now, I just said previously that EAGALA was entirely on the ground, so why would we want to ride the horse? Well, the movement that occurs from riding, it can help release that physical part of trauma. The riding also isn't necessarily what you're thinking beneath you. Perhaps you're sitting tall and strong on a horse and feeling that power and control back in your own life. Perhaps you're lying down and feeling the horse breathe underneath you and allowing that movement to release your trauma. The second is becoming aware of the information they're receiving through their senses. So how do you feel? How does the horse make you feel? How do you make the horse feel? What are you seeing, smelling, hearing, all of these things? What is coming into you and how is that impacting your perception of yourself, your trauma, life, the current moment, and things like that? The final goal is learning to be assertive and set boundaries. One therapist that I interviewed when I was learning about this type of therapy, she says that she always tells her clients, if you can move a 1,000-pound animal and calm it down, then you can absolutely do the same for yourself. That really ties into this goal of eponotherapy, which is setting boundaries, moving the scene in the way that you want to, being assertive, things that often that trauma survivor couldn't do during their traumatic event. Now, a few success stories, and these are probably my favorite success stories in this entire presentation because of how powerful they are. One is about a man who went to multiple weeks of EAT and just couldn't open up. He didn't talk at all. And then one day he saw a horse in a field standing there with its mouth open, and he immediately related to that horse and opened up to the practitioners. He said that he felt like that horse because he had been trying to get his trauma to come out, but he couldn't. The next is a woman who was in an abusive relationship. She came to the facility and this horse came up to her and put his mouth on her arm gently, walked a big lap around the field, came back, nipped her arm a little bit harder, walked another lap, and then came back and really bit her arm. Now, she described these interactions as cute and then love and then pain, and used that sequence to open up about the abusive relationship that she was currently in. The third story is about a man who lost his father. Every day during therapy, every day that he was there, the same horse came up to him and put his nose over his chest. And this guy had no idea what the horse was doing. After a while, he recognized that that horse was his father, telling him that it was okay to move on and that he was okay on the other side. Now, the final one is about a woman standing up to her PTSD. She identified one horse as herself and one horse as her PTSD. The horse she identified as herself came up to her and put her face very close to hers. And she described this moment as breathing in herself again. Later, the horse that she identified as PTSD came up to nip her, and she told it loudly and firmly to back off. Again, being assertive and setting those boundaries. These two moments really chartered this woman's healing journey. Now, if you're interested in finding an equine-assisted therapist in either modality, these are the two places that you can do that. The EAGALA website has a list of facilities right on their website, egala.org/programs. And eponotherapists and recommended instructors are listed at eponaquest.com/recommended-instructors. Canine assisted therapy, while we're on the theme of animal assisted therapy, is the next one that we're going to discuss. The use of dogs in the therapy process can help regulate and pace the opening up and telling of the story by the trauma survivor. Things like petting the dog, taking it on a walk, practicing T-touch, Tellington T-touch, it's a method of massage, or simply breathing with it allows this trauma survivor to open up about their story in a manner that is controlled and paced. Digging too quickly into the story or just getting everything out on the table before they have an opportunity to build a positive relationship with their therapist can actually be re-traumatizing and dangerous. So having this dog as kind of the pace setter can help that happen in a way that's safe for both parties. Dogs are also uniquely able to calm people down and help them reduce their nervousness, partly because they're very easy to relate to. I don't know about you guys, but if you go to a party or if I go to a party and there's a dog at the party, about 10 minutes in, I'm going to be in the corner hanging out with the dog while everyone else is talking. So they're very intuitive, they're very people friendly, and they're really great having in the therapeutic process simply because of how relatable they are. Now, there are 3 types of working dogs that you may encounter when you're looking at mental health in dogs. The first of which is an ESA, an emotional support animal. An emotional support animal is simply a pet whose presence makes you feel better. There is no documentation or any sort of training required for this animal, and they are allowed in the cabins of airplanes and in federal housing with a letter from the handler's doctor stating their need for an ESA. The second type of dog is a therapy dog, and these are dogs that live with the therapist, not the trauma survivor, or the handler, not the trauma survivor, and they've undergone a training program to be certified as a therapy dog. They're often used in nursing homes and mental health facilities to, again, aid in the therapeutic process. Now, if you or someone you know is going to canine-assisted therapy, they're going to be working with a therapy dog as opposed to an ESA. The final category is a service dog, and service dogs are owned by the trauma survivor, and they're trained to provide a specific service to one person. So, for example, they could wake up their handler when they start to have a nightmare, alert them when they start to dissociate. Dogs that are placed with people with other disabilities can be seizure alert dogs, diabetic alert dogs, different things like that. But they perform a specific service for a specific person. They are protected under the ADA and are allowed to go anywhere with their handler. So anywhere that a person can go, they can go too. The only reason that they would be removed from a situation is if they were dangerous or if they weren't potty trained. Now, canine-assisted therapy is not really regulated like other forms of therapy. So searching for therapy dogs near me, canine-assisted therapy, things like that is probably the best place to start. The American Kennel Club also has a list of training programs for therapy dogs on their website, but those are going to be places that train therapy dogs, so they might be able to refer you to a therapist who has been through their program. So if you can't find anything through Google, start with the AKC and just start making some phone calls and seeing what's out there. Ecotherapy is the second to last therapy we're going to discuss. And the reason that this is one of my favorite therapies out there is because nature has the power to heal woven into every fiber of its being. Nature can help trauma survivors form meaningful connections, distance themselves from their traumatic experience, pull meaning out of their current situation, find comfort and safety, and receive physical nurturing. Ecotherapy is simply the process of incorporating nature into the therapy program. Nature has so many incredible benefits, and I'm not going to list all of them here, but I do want to share a few just so you can understand the breadth of things that nature can help with. In terms of physiological benefits, studies have shown that time spent in nature causes decrease in heart rate, salivary cortisol levels, blood pressure and cholesterol, and decreases in the risk for type 2 diabetes, cardiovascular disease, and all-around mortality. In addition, rates of stroke and asthma decrease with an increased exposure to nature. While these are cool, it's not super obvious why these are necessarily related to trauma. But remember that ACEs study that we talked about in the beginning? How childhood trauma can result in adverse adult health outcomes? Nature can address some of those physiological health outcomes that may be the top layer to trauma. In terms of psychological benefits, nature helps with recovery from mental fatigue, it reduces stress, it can result in a reduction of symptoms accompanying depression and anxiety. Other mental health benefits include attention restoration, positive emotions, relaxation, fresh energy, and an increase in things like self-concept and feelings of self-worth. Nature is so powerful for a variety of reasons, and I wanted to highlight a few of these specifically. The first of which is this concept of being away. When you spend time in nature, you give yourselves the opportunity to distance yourself from your trauma. You're no longer living in that traumatic experience and being reminded of it day in and day out. You can literally distance yourself from that time in your life. Nature as well, it's something bigger than us. There's something spiritual about nature, and that can allow you or a trauma survivor to connect to something greater than themselves. Fascination as well is really important about nature. You don't have to try and appreciate nature, right? You don't look at a sunset and go, okay, I have to try to appreciate this sunset. You just know that it's beautiful. What this does is it allows your voluntary attention, which is what you're relying on right now to listen to this presentation, relax and recuperate while your involuntary attention takes over. Finally, compatibility. There is some part of nature that is compatible with everyone, no matter their preferences or abilities. Ecotherapy, like I said, is when nature acts as a co-therapist. It acts as the bridge between your lockdown emotions and your trauma and that open and healing discussion with your therapist. The sights and sounds that are seen while in nature serve as metaphors, just like EAGALA, equine-assisted therapy. At natural pauses, the trauma survivor will be encouraged to notice how you feel, what thoughts or emotions are coming up for them, and what they see as they look at the scene in front of them. Indoor ecotherapy is also a thing, and that sounds completely oxymoronic, but it's really important for individuals who can't do outdoor ecotherapy. For example, a late-stage cancer patient probably can't do a long nature walk, and so indoor ecotherapy is a good option. Indoor ecotherapy is simply the process of bringing nature indoors. So nature paintings, sandboxes that they can play with, sounds of bird song, little bubbly fountains that make water sounds. Things like that bring nature indoors and actually bring some of that healing power indoors as well. One thing that's really cool about this is that the original studies on the power of nature and how nature helped with psychological and physiological health problems were done with paintings of nature. It wasn't even nature itself, it was a painting and a photograph of trees. So indoor ecotherapy does have some of those same benefits as actually being outdoors in nature. Now, again, there is no certifying body for ecotherapy. So just like canine-assisted therapy, search for something like ecotherapists near me, and then just start to check their mental health credentials from there. Finally, nature can be used without a therapist, though I would recommend using it with and without as opposed to just without. If the trauma survivor wants to use nature in their healing journey, you can help them find a spot that feels very peaceful and relaxing to them and encourage them to visit it frequently. It could be a specific tree in their backyard. It could be a park. It could be a hike that takes them to the top of a hill with a beautiful view. Whatever that space is for them, that can be used as homework in between sessions. Flower essence therapy is the last therapy we're going to talk about today. What it is it combines the power of nature that we just talked about with flower's ability to resonate with the body. Now, flower essence therapy is new in the US, so if you haven't heard of it, you are certainly not alone, but it's actually pretty established in other parts of the world. It's part of standardized healthcare and standard hospital practice in places like Switzerland, Brazil, and Cuba. So again, while it's new here, that doesn't mean that it's completely foreign all the way around the world. The flower essences are not aromatherapy or essential oils. They're made by imprinting the blueprint of the flower into natural spring water. The essences are very dilute as well, so it's odorless and tasteless. Again, not like aromatherapy or essential oils. The energy that's transferred through these flower essences is similar to chi. If you're struggling to understand, okay, what is this essence? What is this energy? What is this blueprint? Just think of chi. Now, what's really cool about flower essence therapy is it doesn't actually treat the illness, it treats the personality. So flower essence therapy was founded when Dr. Edward Bach observed personality traits and found that flowers resonated with specific traits. In other words, flower essence therapy is not going to come in and treat PTSD, but it's going to treat the emotions and personality parts that go along with PTSD. For example, rock rose is one flower that's commonly used in PTSD treatment, and that calms the adrenals and minimizes the effect of the fight, flight, or freeze response. Star of Bethlehem is another common one, and that helps rewire the energetic and nervous systems. What flower essence therapy does is it uses the resonance of plants, that blueprint, to release the trauma that's stuck in the body. These essences can also support in the release so that all of the emotions and that completed cycle that we talked about with dance movement therapy isn't so overwhelming to this trauma survivor. Again, with craniosacral therapy, this was one that I heard and I was like, okay, that's cool. Yeah, right? So if you're feeling that way, I want to share with you some studies that show how powerful flower essence therapy can be. The first few set of studies talk about flower essence therapy and depression. Now, depression and PTSD are often comorbid, so this isn't totally unrelated. 3 months of flower essence therapy can result in anywhere from a 50 to 80% decrease in depression symptoms, and 4 months of treatment can result in up to an 89% improvement in anxiety, stress, and depression. Now, for trauma specifically, 2 case studies showed that flower essence therapy for young individuals who had trauma alongside their learning challenges improved their maturity, their independence, and their ability to focus, decreased their fear, self-centeredness, and anxiety, and helped them relax. Now, this study is my favorite one out of pretty much every study I've ever read. And this was a study done in 1997 that examined how much skepticism affected the result of flower essence therapy. So essentially, it was testing whether it was a placebo or not. And what this study found was that the effects of flower essence therapy were there and just as powerful, no matter how skeptical you were about whether it worked or not. It's a pretty cool study, right? Now, flower essence therapy, because it's so new in the US, it's not as regulated as other forms of therapy. The best way to find a practitioner and make sure that they're actually qualified enough to help you or someone you know through their trauma healing journey is to simply ask about their training. If they've done multiple years of training, or better yet, if they've been mentored by an experienced flower essence therapist, then they're probably a good bet. If they are like, oh, I've done 100 hours of training, or I've done a year of training or something like that, that's really not enough to have the support that is needed for a true trauma healing journey. You can also approach this from the other way, and that is finding licensed mental health professionals who also practice flower essence therapy. For some of these methodologies of therapy that are not quite as regulated or don't have one certifying body, like flower essence therapy, canine-assisted therapy, things like that, I would recommend going about it this way. Start with the mental health piece. So find an LPC, find an LCSW, find a psychiatrist, a psychologist, someone that has a license in mental health, and then narrow that pool down to those who practice the type of therapy or the modality of healing that you want to work in. That way you're guaranteeing that you or someone you know, that their mental health needs are going to be taken care of, as well as that they have that extra piece of the type of therapy that you want to undergo. If you go about it the other way, where you start with someone who is this great flower essence therapist, but they've never worked with someone with trauma in their lives, you could be putting you or someone you know in a bit of a dangerous position because they don't have that support that's necessary to move you or someone you know through the healing journey and deal with any road bumps, flashbacks, triggers, dissociations that may come up. Now, to recap everything we've talked about today before we head into this Q&A session. Trauma. What is it? Why is it important? Well, it affects an estimated 70% of Americans, and with the current climate, the windstorm, the racial injustices, the police brutality, everything that's happening with COVID-19, especially at the start of a new school year, it's an even more important concern to talk about. The symptoms of trauma are as wide as there are types of trees in the world, right? There are so many different types of physiological and psychological health symptoms, some of which are tied into childhood trauma. If you know that someone is struggling to heal from trauma, or maybe you suspect it based on how you've seen them change, how they've interacted with you, you recognize some of the symptoms that I mentioned, the best way to support them is to hold this space for them and connect them to any resources that they may need. Again, holding the space for them means that you are creating a safe container for them to show up exactly as they are, where they're not going to be judged, they're not going to be criticized, they're not going to be shamed, they're not going to be tried to be fixed or anything like that. They can show up as they are, let it all hang loose, and know that they're going to be loved, accepted, and supported no matter what. The final piece, which we spent the bulk of our time together talking about, is the concept of integrative therapies. Again, talk therapy is incredibly well supported by research, incredibly well supported by expert testimony, and may work for some trauma survivors. But unfortunately, because it doesn't address that primal and somatic part of trauma, it may not be enough. That's where integrative therapies like ecotherapy, dance movement therapy, canine-assisted therapy, things like that can come in and either be a good addition to or alternative to talk therapy for trauma survivors. Now, in terms of the educational content of today, that is all I have for you, and I thank you so much for your time and attention. I will be sticking around for about another hour here to answer any questions that you have, things that I wasn't clear on, things that you want more detail on, anything like that, feel free to ask me. I know that mental health can be a bit of a personal topic though, so if you're someone who wants to share their story, ask a more personal question, or just doesn't feel comfortable doing it in a group setting, my contact information is on the screen. So feel free to shoot me an email, send me a message through the contact form on my website, send me a message on Instagram, however you want to get in touch with me to have that personal discussion. I would absolutely love to have that with you. Regardless, I thank you so much for your time and attention today. I am really excited for this question and answer session to get to know you guys, answer your questions, and again, give clarity or go into more depth about anything that I talked about today. I'll see you in the Q&A session, everyone. Thanks again.